Hi, this is Dr. A with your Intro to U.S. Healthcare lesson on Chapter 13 of the 5th edition of the Basics of the U.S. Healthcare System. So we are looking at mental health issues, and we're going to spend a little bit here looking at different special populations. All right, let's start with children and teens. So according to NIM, just over 20% or 1 in 5 of children either currently or at some point during their life suffer from depression. Suicide is a major concern among children and adolescents. In 2021 alone, nearly 5,000 youth in the United States younger than 25 years died by suicide. It is particularly difficult to assess teen mental disorders because of their stage in life. And part of that meaning that they tend to not want to share, especially, or not share with their parents or other people, authorities, that they're having trouble. They may share it with their friends. And so it's really important that there's open communication with children and teens, either with their parents or with a counselor, trusted adult, or a friend. And if you are the friend who had somebody, confided and they're having trouble, it is okay. It is your responsibility to reach out to the parents or to a counselor or something so that your friend can get help. So you want there to be an intervention or something addressed, therapy started if there is a mental disorder. According to the APA, it is important that parents recognize problems in their children so that they can be treated appropriately. Home and school changes can create stress and anxiety in young children and adolescents. So sometimes, especially changing schools, but sometimes just moving up in grades, new friends, old friends, problems with friends, school life can be difficult and home life can be difficult for children. The pandemic pushed stress levels to really high levels in children and adolescents, especially when they had to do a lot of this remote learning, virtual learning. They got disconnected from all their friends. And it is really important for children and adolescents to be connected to their friends and physically, as in seeing each other in person. It's good to be able to text back and forth and to FaceTime. But nothing quite replaces this in-person connection that we have. Between 2016 and 2020, anxiety and depression diagnosis increased by 29 and 27% respectively. That is in children and teenagers. Signs of stress can manifest in different behaviors such as anger issues, poor sleeping patterns, eating changes, a drop in school performance, or having physical ailments. So all of these should be warning signs or things that maybe a parent should look deeper to see, if their children need help and get them that help. The National Institutes of Health produced a report that outlined a universal screening model. It's called the clinical pathway model to screen youth for risk in the medical setting. So that would be in the primary care setting when they go see their pediatrician or their family doctor. The initial screen, which takes about 20 seconds, is called an Ask Suicide Screening Questions, an ASQ. So these are some standard questions that a primary care provider can ask a child or youth to answer. And if it flags if there's something there, in their initial screening questions that needs to be looked into further, then there's a second tier which takes about 15 minutes. So it's another assessment tool, and it's called Brief Suicide Safety Assessment. And it is a tool that is used to classify the suicide risk as low, high, or imminent based on the survey responses and clinical judgments. Next, we're going to look at veterans. In 1989, the National Center for Post-Traumatic Stress Disorder was created with the VA to address the need for military-related PTSD help, basically. So a lot of our veterans have PTSD. The suicide rate for male veterans that are 18 to 29 years of age rose 26% from 2005 to 2007, with record rates in 2009. mental health issues are the leading cause of hospitalizations for active duty military. So mental health is so important to our, all of our military personnel, whether it's a veteran or active duty, and it's part of our readiness to serve and readiness, for defense. Military personnel, of course, can experience several types of mental health conditions, but they include PTSD, traumatic brain injury, and these are usually combat-related, and major depressive disorders, which is also combat-related and also being separated from family and friends. Compared to the civilian population, major depressive disorders are 5 times more prevalent in the military, and PTSD is 15 times more prevalent. So again, this is a population in which these are often seen. The National Council for Mental Well-Being statistics indicate that reserve and active military in Iraq and Afghanistan require treatment for these PTSD, TBIs, and major depressive disorders. Approximately 30% of the military and combat situations struggled with major depressive disorders and PTSD, which is post-traumatic stress disorder. As many as 50% of veterans do not receive mental health care, despite the fact that there are 755 VA-operated outpatient clinics, 380 sites and mobile units, and 170 medical centers in the United States. And part of that has to do with the idea of, being in the military and serving and being a soldier and being tough and strong and being able to take it and do all the hard things. Makes it more difficult to admit that one needs help, especially with the mental health. But it is imperative that if you're in the military or if you have a friend or loved one in the military and they need help, that they seek help, because it has to be addressed, and the sooner you address it, the better. There are many different resources for our active duty and veterans to seek help. Between 2016 and 2019, the number of veterans receiving mental health treatment did increase by 90%. So that is a gain. We're increasing awareness, destigmatizing, getting help. The VA indicates that veterans are 1.5 times more likely to commit suicide, which is, again, not a good thing. This is something we need to help our veterans with. And telehealth visits have increased by 200% during the first 8 months of the pandemic. Telehealth visits can increase access to mental health treatment for this population and therefore decrease the risk of suicide. Our next special population are the elderly. So as we age, we will experience loss of family members and friends, which is a major trigger of depression and possibly even suicide too in this population. Many elderly are not treated for mental illness for several reasons. First, the elderly are focused on seeing their primary care provider for their main ailments. So both the patient and the provider may ignore the symptoms and maybe just focus on what's going on physically, whether it be heart disease or cancer or high blood pressure or GI issues or stroke or something. There's usually something medical going on with our elderly, and that tends to be kind of it steals the focus, and the mental health things can go unaddressed. Also, primary care providers may not be comfortable addressing mental health issues. They may not have the training even to recognize signs and symptoms of mental health issues in the elderly. And then if the elderly patient is referred to a psychologist, a recent APA survey indicated that fewer than 30% of psychologists have the graduate coursework in what we call geropsychology, which deals with mental health issues in the elderly. So, it'll be difficult for them to find a provider that's appropriately trained to help address the issues that they're having. The APA has provided guidelines for these psychologists. It's called Guideline 20. And this is for psychologists to help these older adults. Depression can strike more than 10% of the elderly population, and it can imitate dementia because its victims withdraw, cannot focus, and appear confused, which are the same signs and symptoms as dementia. Only 15% of the elderly population suffers from dementia, And of that percentage, over 60% suffer from Alzheimer's disease, for which there is no cure as of this writing. Approximately 40% of dementias are caused by conditions such as high blood pressure or stroke or other diseases such as Parkinson's and Huntington's disease, which are disorders that in their advanced stages can cause dementia. And pseudodementia, also known as false dementias, can develop as a result of medications, which a lot of our elderly people are on a lot of medications. It could be from drug interactions, poor diets, and also heart and gland diseases. So there are so many different factors that can play here to cause pseudodementias and depressions and mental health issues. So these dementias could occur accidentally because of these conditions. Many elderly patients have multiple prescriptions, so it is important to note any potential interactions that could result in dementia. I would enlist the help of your pharmacist for that, because that is what they are trained to do. Seniors 65 years and older are the fastest growing segment of the U.S. population because of our life expectancy that has increased over the decades. Although we have had a recent life expectancy decline due to the pandemic, still we have a large population of people that are 65 and older. So there's also an increasing number of older adults that represent different cultures and ethnicities. It is anticipated that by 2030, the number of older adults with mental and behavioral illnesses will be 15 million. So that is a lot. Mental health services should be a collaboration with the primary care providers of the elderly patients, maybe offering mental health services at the adult daycare centers or the senior centers. That would increase accessibility and treatments for that population. So let's talk a little bit about mental health and culture. Mental health disorders can occur across race and culture. So the three groups, two of the three groups we looked at were age-related. One, of course, was, service-related, so military service. So, like, obviously, maybe you could call that job-related. So now let's look at it in the lens of culture. So, unfortunately, there are diverse communities that are often underserved, and this is, again, across race and culture. And so we're going to look at mental health information related to some of these cultures. So we're going to look at mental health in LGBTQI community. We're going to look at African Americans, Latinos, Asian Americans, and also American Indians and Alaskan Natives. So too often, culture may negatively impact what we learn about mental health. Messages of staying tough can cause people to ignore the mental health issues. This can be especially true in men, and of course, men that have served also in the military, so you can combine that. And then if you add to that that people of color have been marginalized in the United States because they experience racism, which often leads to mental health issues. And so if you add race to serving and being in some of these other populations, it can increase the risk of having mental health issues. All right, the LGBTQI population. So they are at higher risk of depression or anxiety. LGBT individuals are twice as likely as heterosexuals to experience a mental health condition. Part of that's the fear of coming out or being discriminated against for sexual orientation can lead to mental health disorders, so it can increase anxiety and depression. Thoughts of suicide and substance abuse can be issues with this community. Some individuals also hide their orientation from the mental health system because of fear of being ridiculed or maybe not treated fairly or properly. The term minority stress stems from the social stigma, the prejudice, the denial of civil rights, victimization, and family rejection that can occur. With any population that experiences mental health distress, it is important that people feel comfortable reaching out for assistance. For LGBTQI people ranging in age between 10 and 24 years, suicide is one of the leading causes of death. An estimated 20 to 30% of LGBTQI individuals report substance abuse problems compared to 9% of the general population. So that's double, if not triple, what we see in the general population. And especially if there are youth of color, they can have an even greater risk of suicide, especially if they've experienced discrimination as related to race on top of sexual orientation. A 2021 survey of 35,000 respondents between the ages of 13 and 14 in the U.S. included data on suicide risk. The data revealed disparities in suicide risk for the LGBTQI youth of color. So there are some resources for this population. GLMA are health professionals advancing LGBTQ equality. So you can go to their website and check them out. They do have a healthcare directory to provide, they have some transgender health resources and a provider directory that you can access. You can also review resources on the rights and experiences of LGBTQI people in mental health care at the Center for American Progress. And this addresses more than just LGBT issues, okay? And you can also look at the Equality Federation, and that's more targeted to LGBT issues at equalityfederation.org. Next, we're going to talk about African American. So over 13% of the U.S. population identify themselves as Black or African American. This percentage represents 7 million individuals. Over 16% reported having a mental illness episode in the past year. Some African American are hesitant to access mental health care due to prior misdiagnoses, inadequate treatment, and cultural misunderstandings. There is a small percentage of psychologists, psychiatrists, and social workers who are African American. This number is increasing, which will increase access and increase, culturally competent care for this population. But again, we need to continue recruiting and increase representation in our mental health field for all the populations. African American may seek treatment from the clergy, so they may trust their pastor more than mental health professionals and try to get mental health care or therapy from them. There are 5 million Black individuals who suffer from a mental health issue. However, only 1 out of 3 seek treatment, so about 1/3 of them only seek treatment. Unfortunately, there's a higher percentage of African Americans in the foster home system, in the homeless population, and the prisons. And all of those environments have a higher level of mental health disorders than other environments. Next are the Latino. So the Latino or Latinx population has been identified as a high-risk group for depression, anxiety, and substance abuse. Approximately 18% of the U.S. population, or 10 million people, consider themselves Latino or Hispanic. Over 16% reported a mental health condition over in 2022. Like the African American population, Latinos may seek treatment from the clergy rather than specialists, and it's the same reason. There's a small percentage of Latinos who are mental health professionals, so then the comfort level is lower between the patient and the provider. This is also tied to language barriers, so we need to increase representation of Latinos and our mental health professionals, and it would be even better if they were bilingual so that they could, therapy could be given in the appropriate language. Next are the Asian Americans. So they have the highest life expectancy of any ethnic group in the United States, and mental health disorders are lower among Asians and whites, but they are also much less likely to report mental health disorders to friends or medical professionals because they feel that it's shameful and consider it a personal weakness. So they do have the highest life expectancy, but maybe their mental health issues are underreported. They will seek help for mental health disorders from alternative medicine providers. So think, traditional Chinese medicine providers. There are possible barriers with language, and the suicide rates of elderly and young Asian American women are higher than those of women of other ethnicities. This might have to do with expectations from their culture, and, you know, maybe feeling that they are not meeting the expectations. Then we have our American Indians and Alaskan Natives. Over 28% of American Indian or Alaskan Native adults live with a mental health condition. They report high rates of depression, suicide, and substance abuse. They report PTSD at rates more than twice of the population reports. Statistics indicate that American Indian and Alaskan Native youth use alcohol by age 14. They also use marijuana and prescription medication at twice the rate of the national average. So there is a big addiction issue there. The Indian Health Services uses tele-behavioral health, which is a method of service delivery that broadens the availability and quality of care across all the behavioral health program areas and increases accessibility for this population. The homeless. In 2020, there were over 580,000 people that were homeless in the United States. This statistics is underreported. This is difficult to, get a true count of them. Over 70% of homeless people are individuals, and the remaining 30% are families that are homeless. Chronic homelessness refers to individuals who are disabled and comprise 19% of the homeless population. Males are more likely to be homeless than females, and 57% of the homeless reside either in California, New York, Florida, Texas, and Washington. These are also, most of those are places where it's really expensive to live. Depression. We're going to last address women. This is our last population. Depression affects nearly twice as many women than men. Women tend to experience it earlier, longer, and more severely. And women who are depressed experience episodes nearly twice as often as men who are depressed. I think also women are more in tune with all their emotions and more in their field, so they are more likely, I think, to experience depression. Women may also feel depressed as a result of infertility, miscarriage, and menopause. Married women suffer depression more than married men. And the more children a woman has, the more likely she may suffer from depression. Women who have been victims of sexual abuse or domestic violence may also suffer from depression. And that's, who wouldn't, right? That's almost a natural reaction to that. Women in nursing homes do not often receive mental health care. And throughout their lives, women have been traditional caregivers, so they may provide up to 13 hours of care a day for more than 20 years for both physical and emotional illnesses. And so they're in this role of giving, and they can often become depleted because of that. Research indicates that healthcare providers do not provide appropriate mental health care to a large majority of older women. Depression in women is often misdiagnosed between 30 and 50% of the time, or it is ignored, or again, signs and symptoms aren't recognized. There was, of course, a whole, attitude when the majority of the physicians were men that it was just in their head, they were just overreacting, they were hypochondriacs and things like that. But it's gotten better, but there's still a lot of misdiagnoses. Okay, so that wraps up our looking at all the special population. We have one more video on for our mental health chapter, and we'll get to that next.